Yo, yo, yo. Hey guys, welcome back to another amazing edition of the Best Practices Show. Are you wondering, should I have an associate? I'm an owner or I'm an associate. How do I find the right owner? Well, today, my job here is one thing: to find the best speakers, teachers, dentists, thinkers anywhere in the world and bring them to you on this podcast to help you create a better practice and better life. And we found a rock star in the DSD community. Christian Coachman told me, you got to talk to Sean Bahrami. And I'm like, who is this guy? Well, what he's done is remarkable. And so we had him on the podcast, and he recently did a masterclass for us called Empowering the Owner-Associate Synergy. It's fantastic. It's so good, I thought we would share it on the podcast. So please listen up. I hope you guys enjoy this, and we'll see you soon. In the podcast that I've been doing with Christian Coachman, Christian's obviously been a great friend, a great mentor. He introduces me to so many people all over the world. Yeah. And as we were chatting, we always treatment plan. So every quarter we sit down, we treatment plan episodes. And so he'll go, okay, we got to do an AI. He goes, I got this kid. I'm like, who's this kid? He goes, Sean. And I go, tell me about Sean. He goes, what Sean's done is pretty remarkable, just how he thinks. He had a very unique situation, and what he's done. He said that, you were going to become, if not, you're already part of the DSD curriculum. And you guys are going to enjoy this today because he's got a great story and a great framework and a great process in this. So I'm thrilled, and I know we'll see more and more of you as the years go by here. So
thank you. I hope so too.
Yeah.
Awesome. Well, I'll add a little bit to that. Dr. Sean Bahrami, a native of Germantown, Maryland, obtained his dental education at the University of Maryland School of Dentistry. His academic and clinical achievements led to acceptance into Diamond Scholars Program at the University of Maryland, where he received education on complex restorative dental procedures and full mouth rehab cases. After completing his dental degree, he embarked on his professional journey at Supertooth Dental Group, a practice founded by his uncle. Together, they successfully expanded the practice to 4 locations within a span of 5 years. And his primary focus lies in cosmetic dentistry, where he seamlessly integrates technical expertise with a deep commitment to enhancing patients' smiles. In addition to clinical practice, he's the founder and president of the Dental Wellness Society. I hope you talk more about this because it's a nonprofit organization that focuses on inspiring and empowering dental professionals to achieve holistic well-being and career longevity through comprehensive health education, community support, and lifestyle advocacy. Dr. maintains active memberships with the ADA, Omicron Kappa Upsilon, and the American Academy of Clear Aligners. As a recognized expert, he serves as a speaker for Align Technology and lectures at the University of Maryland on patient management and cosmetic dentistry. Dr. Bahrami's commitment to excellence is evident in both his clinical practice and contributions to the dental community. And we are so happy to have you today. Thanks for joining.
Of course, my pleasure. What an honor to be spending my Friday morning with you guys. And I hope everyone enjoys the lecture. So if you guys are ready, I'll get to it.
Sure. Go ahead and share your screen. Optimize for video too. Perfect.
Excellent. So when we talk about growing a practice or making a practice successful, oftentimes we focus on things like marketing or bringing a new technology or procedure to the practice. But one of the most fundamental part of every practice is the owner-associate relationship. Oftentimes, this relationship is tricky and can be the limiting factor in the success of the practice. Owners aren't happy with how associates carry themselves in the practice. and associates aren't happy with some of the systems or lack of systems in the practice. In navigating this dynamic relationship, what's important for us to do is to highlight some of the key differences between the mindset of each side. Owners are experienced as a result of doing dentistry for an extended amount of time and managing a practice. They have solidified their mindset and they're more likely to rely on what has been working for them. And typically they are financially successful, or they're at a point where they like to slow down but continue to live the same lifestyle, and that's when they onboard an associate. On the other hand, associates are ambitious, but they have a managed ego. For whatever reason, when they're coming out of dental school, they think they should be given guaranteed income. They think that all the patients should be provided to the practice, but they're also about bringing new systems and streamlining processes to improve efficiency. This generation is excited and passionate about the new innovation and technology development of dentistry. As a result of how expensive schooling is nowadays, I think a lot of the young dentists make their career decisions based on financial pressure. So how can we create a synergy between the owner and the associate? Well, I'm going to talk about my history and what qualifies me to be discussing this topic with you. Then I'm going to introduce you guys to the associate owner duo, Dr. Ben, Dr. Sean. I'm going to talk about some of the challenges of owning a dental practice. And then I'm going to highlight an important process, which is hiring and onboarding the ideal associate. Then we're going to switch to the associate side, some of the challenges that new associates face and the career moments. And then we're going to talk about how to become the ideal associate. So let's get to it. Well, my history, I graduated from University of Maryland back in 2018, as Angela talked about. I faced the same situation that many new grads face, and that is, where do I start my career? My 27-year-old mind thought that the best way for me to go about this is to find a dentist who is at the end of his career, her career, and I could learn from them and eventually acquire the practice from that person. Ideally, someone that looked like this, right? They're coming to the practice, they're wearing their new balanced white shoes, they're practicing 2-3 days a week, and I can learn from them, bring new ideas to the practice, grow the practice, and make it my own. But after talking to many dentists and visiting many practices, I decided to do what most people told me not to do, which was to work with my family, my uncle. Especially in Iranian culture, where you don't voice your opinion because of respect for the elderly. And if you do, your whole family would get involved and it could lead to drama. This was a formidable risk that I was willing to take. So I decided to work with my uncle. Now I'm going to introduce you guys to the duo, the Dr. Ben, the owner, and Dr. Sean, the associate. Dr. Ben has been practicing dentistry for as long as Dr. Sean has been alive. He is a super general dentist, and some say a great businessman. He has afforded a great lifestyle, expensive cars, expensive house, kids in private school. And his motto is, I want to drive the $100,000 car today, not when I'm 80 years old. As a result, he works 6 days a week. And if he goes on vacation, there's no income coming in, and he doesn't have a retirement plan. But he is at his second half of his career thinking, how can I slow down but continue to live the same lifestyle? He has 2 dental offices doing 1.8 million, but he's tired of bringing new associates, training them, and watching them leave. And he thinks money is earned just because you have a dental degree. It doesn't entitle you to any type of guaranteed income. You have to earn your salary. When retention is poor, his PFM crowns never let him down. He says that all the patients in the practice, they want to see me and me only. When he does his exam after a hygiene appointment, his treatment plan presentation is about 20 seconds, where he tells the patient you need some fillings, some crowns, the front desk will schedule you. His clinical notes are legendary. I'm going to give you guys actually a sample of one of his notes. Here we go. So it says, loose abutment / crown number 12, 13, removed number 12, tighten up, could not remove number 12, will try in a week. I don't know if anyone understood what actually happened in that appointment, but it's some type of coded language that only he can decipher, but he'll know exactly what happened during that appointment. On the other hand, we have Dr. Sean. Dr. Sean is a recent graduate. He is ambitious. He wants to work 6 days a week, and he's interested in the new technology and developments in dentistry. He's not looking for a typical 9 to 5, but he's looking for an organization to be a part of and become a successful healthcare provider. After 20 years of schooling, he's got $368,000 of student loans, but he has unmanaged expectations of dentistry. He thinks just because he has a dental degree that he should be given guaranteed $800 minimum daily, even though a class 2 filling on incipient lesion on number 5 takes about an hour and 48 minutes to do. He calls himself a cosmetic dentist because he did 6 class 5 bondings in dental school where they looked amazing. Now he thinks he's ready for a full case veneer. And this is his post after those class 5 bondings. He captioned it "Smile Transformation," which is very generous. And then he put hashtag full mouth rehab, which I think it's also very generous because at most, this is not even a quarter of a mouth rehab. Teeth are still chipped, they're still crooked, but he calls himself a cosmetic dentist. He hates PFM crowns. He doesn't like the cementation process. The cleaning up the cement is messy, so he never does PFM crowns. When he writes notes, he imagines that he's standing in front of a jury and he's writing every word sentence per sentence to make sure, because you can never write enough. And this is the comparison between Dr. Ben's notes and Dr. Sean's notes, writing paragraphs. Now we have these two individuals who are at different parts of their career. They have different trainings, different ideologies. So how can we bring them together and create a successful practice with a smooth transition? Well, believe it or not, Dr. Sean and Dr. Ben actually did it. Dr. Sean joined Supertooth, which actually had another name. We changed the name to Supertooth in 2018. And at that point, there were 2 locations. That's where you see the different colors. Over the next 4 years, Supertooth went from 2 locations to 4 locations and nearly tripling the collection. And you may ask, how did that happen over relatively a short period of time? Well, that's what we're going to talk about today. We're going to talk about Dr. Ben's role in this growth, and we're going to talk about what things Dr. Sean did to help facilitate the growth of the practice. But I want to talk about some of the challenges of owning a dental practice, challenges that Dr. Ben faces day to day. For starters, one that we all know is that corporate dentistry is growing at a fast pace. In 2005, 84% of dental practices were privately owned. That number has dropped to 73%. Now, it's no secret to any of us that corporate dentistry, they have more negotiation power, they have lower cost of products, they have better advertising tools, and higher reimbursement rates from insurance. As a result, they enjoy better profit margins. And corporations are actually teaming up against solo practitioners. And you may ask, how is that possible? Well, for starters, Morgan Stanley did a study that showed dental insurance reimbursements for solo practitioners has declined from 2017 to 18 and 18 to 19. And the reason this is happening is because there's such a vast network of dentists who are participating with insurances. 80% of the US population has dental insurance. And the people who have dental insurance, there are 2.5 times more likely to be visiting a dentist. As a result, there's a lot of dentists participating with networks, insurances, and insurances don't see the need to really negotiate their fees anymore. So their reimbursements are going down. Another thing insurances are doing, it's called network leasing. which basically means that when you are signing with one insurance plan, they bundle up multiple plans together. So without your knowledge, you're actually accepting multiple PPO plans or insurance plans. And the American Dental Association released a statement saying that unfortunately this is happening. And if you are signing with one PPO, you could be potentially accepting dozens or even hundreds of plans across country. And being the powerful organization American Dental Association is, and it will protect the solo practitioners, they have a solution to this problem. And the solution is you just need to read the contracts more carefully because this is already happening in 24 states. In addition to this, insurances are trying to control the flow of patients, where the patients go. Delta Dental actually sent a letter to employers informing them that if your employees choose to go to an out-of-network dentist, that could mean that the cost of you providing insurance for your employees will rise. And then they elaborate that Delta Dental dentists, they go through rigorous credential checks and quality management program, which we know it's not true. And then they put a picture of this guy showing that he's very happy to participate with Delta Dental. But in reality, we know he's looking at the fees and this is how he feels on the inside. And then they actually say there are ways for you to incentivize your employees to continue to go into an in-network dentist. And I'm sure you guys are aware, one thing insurances do when a patient goes to an out-of-network dentist, they send them an EOB explaining how much money they would have saved if they had chosen to go to an in-network dentist. So we have insurance reimbursements are going down, and then insurance are trying to control where our patients are going. And at the same time, the cost of staffing an office has really risen quite a bit over the past few years. In 2018, when I graduated from dental school, our hygienist was making $47 an hour. Now that number is $70 an hour. Only if the stock market was going up at this rate, we could all probably retire by this point. And Delta Dental reimburses us for pro fees $48 an hour. And the assistant pay has also doubled. So these are the challenges that solo practitioners are facing, that the cost is rising, reimbursements are going down, which puts quite a bit of strain on the practice. But because corporate dentistry, they have better profit margin, they can also offer better compensation packages. This is an ad that was posted in Washington, D.C. from a corporate office that basically, I want to share the benefits. So a daily minimum guaranteed, they give a sign-on bonus for $50,000. Now, if you remember Dr. Sean, a new grad who's got $368,000 of student loans, if he sees this ad versus as an office solo practitioner just offering a minimum daily, he's going to seriously consider a job that's going to help him pay a fifth of his student loans. And then they give these benefits of health insurance, 401k, malpractice insurance, so many benefits that a solo practitioner cannot compete with. So what do? Well, we have a dilemma. We have corporate dentistry taking a big share of our patients. We have insurance reimbursements are going down. Cost of staffing is going up. What do we do as small business owners? Well, we can either sell to corporate dentistry or partner up with them, or we can become better at how we run our businesses. Now, even though I say all these things, it is not all rainbows and butterflies for corporate dentistry. For starters, yes, they do offer amazing compensation packages, but financial incentives are not sustainable. I'm sure if you had a job where the pay was great, but you didn't really enjoy the work environment, you didn't last a long time at that position. Because the stereotype for the corporate office is that they're fast-paced, they're focused on numbers, they're business-oriented, and as a result, they have a high turnover rate for staff. And at the same time, even though corporate dentistry is growing, they have to occupy a specific part of dentistry. I don't know if you guys have heard of red ocean or blue ocean strategy. Basically, they describe the type of market your business occupies. If you are in a red ocean business, that means you are in an environment where there's a lot of competition, a lot of people doing what you're doing. As a result, the water is red, it's cutthroat. If you are in a blue ocean market, basically you've created your own market, you created your own environment, so there's not a lot of businesses competing with you. Because of nature of the business for corporate dentistry, they have to work in that red ocean environment, right? That promotional dentistry where there's a lot of competition. They have to make their business less differentiated in order to make it scalable. But that's the beauty of dentistry, is that it's such a clinically complex field. You have all these different specialties, oral surgery, perio, pros. You have different treatment planning philosophies and approaches to dentistry, like biological dentistry, holistic dentistry, sleep apnea, occlusion philosophies. And then there are many types, different ways of executing and going about it with different technology, like CBCT, DSDs, digital scanners, digital photography. As a result, you can really pick any combination of these things and really offer a blue ocean strategy to your patients, something that most offices aren't doing, or at least corporate dentistry is not able to do, because they have to dumb down the dentistry to make it scalable. Another amazing thing about dentistry is the relationships that we develop with our patients and with our staff members. Your staff, they become like family members, right? You celebrate birthdays with them, their weddings, having babies, and even patients, you become very close to them. And these patients, once they feel comfortable with someone, they want to stay with that person for a long time, something that corporate dentistry is going to have a struggle in emulating. This is a patient that I went to her wedding, and she invited us to her wedding because we did a smile makeover for her. And during her wedding speech, actually, she thanked us for giving her a smile for her wedding. I mean, how many people get that kind of treatment as medical professionals? And what you do with these relationships with your patients, it's really up to you. One thing that I decided to bring to our practice was to do yoga with our patients. I wanted to connect with my patients outside the drilling, the noise, the anxiety, the fear, and the phobia. I wanted to be in a calm environment where we can connect. So I brought a yoga instructor, I bought some yoga mats, and Saturday mornings outside our office on the patio, we would do yoga. And then really, these patients become lifelong patients. I enjoy especially working on elderly patients. Some of them, they're at a point where they lost the filter. So whatever comes to their mind, they say it. And this is one of my patients that I've seen for a long time. And every time he comes, we have such a great conversation. And one time I asked him, would it be okay if I take a selfie with you? And he said, sure, go ahead. As a matter of fact, I'm very easy. If I were a woman, I would be pregnant all the time. I said, okay, well, whatever it is, we don't need to know all of that. And this is a picture of our staff members. Some of them been with my uncle for 10, 15 years. Do you think they could have gotten better job offers from corporate offices? Of course they could have. But they chose to stay in the office because of the relationships we developed. So we always talk about corporate dentistry growing and being, we fear that they're going to take a big share of our patients and they're going to take over the market. But dentistry is not like pharmacy, is not like optometry. That relationships we develop with our patients, the ability to really create a blue ocean strategy with using the complexity of dental field gives us an edge over corporate dentistry. Now, even though we say all things, we still need to get better at some of the things and how do we do business. And one of those processes is how we hire and onboard an associate. Many offices, they don't really have a process. They interview some dentists and then they throw them in the mix. If the patients are happy, the numbers look good, then they keep the dentist. But they don't really have a way to decide whether this person fits to their practice or belongs to their practice. I'm going to give you a process that's going to take your onboarding game to the next level. So when you think about the associate onboarding, there's really 4 moments. The first moment is obviously finding and hiring an associate. The second one is testing the associate. The third is empowering. And the fourth is partnering. In order for this sequence of moments to happen successfully, you need to start with moment 0, which is a vision for your practice. Let's dig deeper into each of those. Moment 1 and 0 are really the same, because in order for you to hire the right person means that you have to find someone that believes in your vision. Therefore, your vision for your practice needs to be clear first. You have to build a detailed vision of where you want your practice to be, and then imagine the right individuals you need to help you get there. And many times as dentists, we forego this process. We open an office, we start working, we're hiring, but we don't really have a clear vision for our practice. When you study successful organizations, you really understand how important this process is. Now, I know this is a webinar, so I won't be able to hear you guys explain things, but I had some vision statements that I wanted to share with you, and then you guys would tell me what company that belongs for. But basically, when you read the vision statements, even though you may not know the vision statement of the company, but because you know the culture, you know their products, you know their marketing, you can guess what company that vision statement belongs to. And this is how specific and intentional we need to be about our business. So, what is a vision? Well, a vision is a purpose and aspiration for the present and future. It really guides the decision-making process. And I'm going to help you guys create a vision. So the steps to create a vision, there are 3 of them. The first thing is you need to gather inputs, right? Your core values, the company culture, the future goals. Then the second thing is you need to reflect on key questions like, what is the reason for our being? Why? How? And once you answer these 2 questions, then you go to the third step, which is writing a sentence or 2 that encapsulates the company's desired future and align it with its core values. So first step is you gather input, core values, company culture, future goals. And the second thing is you answer questions like, what is the reason for our being, why, and how? And then you put it all together. When I joined my uncle's practice, there really wasn't a vision statement. His vision was that I want to have a high-end dental practice. I want to provide comprehensive treatment. But then he was also posting ads for $49 cleanings and attracting the wrong type of patients. Patients that are coming for discounted dentistry, they're not looking for the high-end dental practice. So we sat down together and then we wrote a vision statement, and I'm going to share that with you guys, which is our family of compassionate and caring dental professionals deliver the most comprehensive treatment for you and your family under one roof. Now, this one statement really encapsulates everything we're trying to do. What is our culture? Family culture. What type of individuals are we trying to hire? Compassionate and caring. What is our approach to dentistry? Comprehensive treatment planning. And what's our patient population? Families, parents, kids. So now that we have this vision statement, when we are doing marketing, we know who we're targeting. When we are hiring individuals, then we know what type of individuals we're targeting. When we're investing in technology, we know that if we want technology that's going to help us deliver comprehensive treatment plan. So the vision, it all starts with the vision first. So now that you have the vision, then you can go finding the right individual that would believe in your vision. Then we go to the second stage, which is testing. So when you bring an associate to your practice, you really are investing in them for the first few months, right? So at that point, they're developing their patient population, the collection and production may not be there. So you need to test and decide whether this person belongs or fits to your practice as soon as possible. And so when I was thinking about creating a test, I understood that there had to be some criteria that you need to be able to have in order to measure that associate, those criteria for that associate in order to make a decision. And that's when I contacted my mentor, Christian Coachman, because he had a lecture on 5 qualities of an ideal dentist. And I used those qualities to create this ideal associate test. So these qualities, not in order, are charisma, artistic skills, ethics, clinical skills, and scientific background. And each of these skills are given a score from 0 to 5, and then there is a rubric. But to help you guys understand how this test is done, I'm going to go through all the qualities and I'm going to discuss how you can use them to grade an associate. The first one is charisma. Charisma is defined by Google as compelling attractiveness or charm that can inspire devotion in others. But it's a lot more than charm. It's really how you communicate with different people, right? With the staff members, with the patients, your body language. Are you sitting across from patients slouching, low energy, or are you sitting presentable and able to communicate effectively? So based on that, you give a score from 0, meaning not able to communicate effectively, to a score of 5, who's someone who's very good at communication. They have the right body language. They're able to inspire patients to accept treatment plan. They get a score of 5. Then the next one is artistic skills. Now, artistic skills are a bit tricky because sometimes it could even be called artistic talent because it's hard to develop that. Some people possess it, some people don't. But I think we can all agree that every part of dentistry has some art to it. Whether you're an oral surgeon or you're a cosmetic dentistry, there's art in what we do. And if you bring an associate, you need to really decide how good is this associate with the artistic skills. And one thing you could do is give them a pen or paper and have them draw a tooth. But I could tell you, as someone who calls himself a cosmetic dentist, I can't really draw a tooth that well. But another way for you to grade your associate is to look at their work. If you have a digital scanner, you can look at their preps. If you can see the work they do, the fillings, the crowns, then you can give them a grade from 0 to 5. Christian shared with me that when they hire clinicians for DSD clinic, they give them an artistic aptitude test, which basically evaluates them and see if how visually they're able to understand which one is visually balanced, which is not symmetrical, how are their eye and hand skills in drawing a smile. So you're more than welcome to use that or create your own test, but you need to find a way where you can grade that associate from score 0 to 5 on artistic skills. Then the next one is ethics. Unfortunately, you don't really need to be ethical in order to be a successful dentist, but obviously, when you are hiring someone that's going to work under your name and your practice, you want them to be ethical. Ethical in this sense means someone who keeps the well-being of patients in mind, right? That they're not treatment planning to make money, but they're doing things to improve patients' health. Another way to be unethical is that their work is so bad that it is borderline unethical. So again, you give a score from 0 to 5 on ethics to your associate. The next thing, probably the one that we focus on the most as dentists, is clinical skills. We take courses on clinical skills to improve, we learn, we read about to improving our clinical skills. Again, if you have someone that does the work that you see on the left side, which is actually a patient that came to my practice as a new patient, and on his form, he said the temps are bothering my tongue. This poor man had these temps that were placed on his front 2 teeth for 8 months like that, which could be clinical skill 0 or even unethical. And on the right, I took the liberty of putting one of my cases as a score of 5, but you guys get the idea of what score of 0 looks like and what score of 5 looks like. And the next thing is scientific knowledge. Now, scientific knowledge is one of the most important skills in dentistry. It's not just being up to date on the latest technology or developments in dentistry, but it's treatment planning, it's diagnosis, all those which are very important for a successful dentist. So now we go into how do we use these qualities to grade the ideal associate. Well, when I was thinking about making this test, I realized that not every practice cares about the same quality the same way. A cosmetic practice will value different qualities than a general dentistry practice. So in order to reflect that, I decided that there needs to be a table and you need to put these in order that are most important to your practice. So let's say if you have a cosmetic practice, then you would put artistic skills as number 1, and then you give it a score from 0 to 5. But because that skill is more valuable to you, they have different weights. So they're all going to be multiplied. The first skill is going to be multiplied by 3, by 2.5, the second one. And as you go down the list, they have less weight in your evaluation of the associate. So that if you had the ideal associate that got 5 on every one of these categories, they'll get a score of 50. And then the other aspect that I thought about is that, yes, one thing is having these skills and qualities is important, but the person's drive is also an important part of the evaluation. You may have someone who has perfect skills and qualities in every one of these categories, but they're not driven. Or vice versa, you may have someone who's very driven, but they have some deficiencies in some of these qualities. So that should make a difference. So then I added the candidate's drive and then give a score of from 0 to 50. Together, if you add up these two scores, you get a score of 100. So to help you guys kind of understand how this test works and be able to apply it to your practice or your associates, I had my uncle do the test for me. So again, you have to start with the vision, right? Your vision is going to help you decide what qualities matter to your practice, right? We have a practice that wants to do comprehensive dentistry for families, and we're looking for compassionate and caring people. So based on that, we put those qualities in order. The first one is scientific knowledge, because we want someone that's going to have that comprehensive mentality. Then we're dealing with family, so we want someone ethical. And then charisma, obviously being able to interact well with patients. And then clinical skills as number 4. And the last one that we care about is artistic skills, because it's not a cosmetic dentist. So then he gave me scores on all of these, but I'm sure he was generous because he knew I was going to present to you guys. So he wanted to make me look good. And then if you add up all these scores, you get a score of 37.5 out of 50. And then he gave me a score of 40 out of 50 on the drive, which brings my score to 77.5. Now that you guys saw how this test is implemented, I'm going to show you guys now how do we understand the grading system. So the grading system basically means, so once you do the test for the person, and if they get a score below score of 50, that means this person is not a candidate. You don't have an ideal associate, but you have a problem. So this is not a person that fits well to your practice, to your vision. If your candidate gets a score of 50 or 75, this is a person that there is potential that you can invest in, that they might have become that ideal associate. And if you have someone who gets a score of 75 or higher, this is a potential star. This is someone that you want to invest in. The reason that I developed this test is because we had multiple locations, and one of the hardest part of our practice was bringing associates to our practice. So once I created this and I applied it to our practice, then I saw that it really helped us make decisions on the associates we were bringing. And then I shared it with my local dentist in my study club, and they applied it and they thought it was very helpful. So that's something that I want to share with you guys. Now, once the testing is done and you've decided on this candidate, whether you want to continue with them or you letting them go, then you go to the next stage, which is empowering. Empowering is a very important part of this process, because as an owner, this is the part where you have to let go of your ego. You have to let go of things like saying all the patients in the practice, they want to see me and me only. And I remember every time my uncle told me that, it will like rip my heart out, because I'm investing my heart and soul, and I wanted to feel that patients want to see me as well. But he loved saying all the patients want to see me and me only. So that's what it means as an owner to let go, to share the platform with your associate. And when you're meeting new patients, you bring in your associate with you, and you introduce your associate to the patients. Mrs. Jones, you need some implants, some crowns, some class 5 bondings. Here's Dr. Sean, who is a cosmetic dentist, and he's great at class 5 bondings, and he's going to be taking care of that part of your treatment. This is how you're able to share the platform, emphasize the team more than you as a superstar to practice. The other aspect that I encourage owners to do is involving associates and team members in decision-making. I know as an owner, you know the best and you've invested your heart and soul into the practice, but many times we have blind spots in our practice that we don't know, things that our staff members know, our associates know, but we don't know. Bringing them in to help you make decisions is going to give them skin in the game, and they're going to feel like they have a voice and their opinion matters, which is really important. Another thing you could do is that ideal associate test. You can even give it to your team members to do. Your head assistant can do that for the associate, because they actually see the associate interact with patients. So you can involve them by having them score the associate on those qualities. The other thing that you should be doing is being open to new ideas. This is something that my uncle did really well, because when I came in as a young dentist looking for a job and I was interviewing at different places, I would ask them, hey, would you be open if I had an idea or if I wanted to implement a system or a procedure? Now, I remember vividly one dentist told me, I've been doing this for 27 years. What ideas do you think you're going to have that's going to help my practice? And then right then and then I knew this is not for me. I want to be part of a practice, and giving your associate room to bring ideas, it really helps them feel like they belong somewhere and they can grow as a provider. And the last thing is detaching yourself as the owner from the superstar position, right? And that's something that all dentists have, almost dentists, where they want to be the superstar of a practice, right? But you want to share the platform and emphasize the team. One thing that I will share as a kind of a trick to stepping away from the superstar position is the name of your practice. Now, we don't see this too often anymore, but naming your business after yourself, right? Ben Manage DDS. Imagine as an associate who's working for your practice, who's handing out the business card, and it has someone else's name in big letters above their name, and you see Sean Bahrami in small letters in the corner. How would that associate feel? Versus having a name that is generic, like Supertooth, and then you have Sean Bahrami, the dentist, right? It's these little things that add up, but they have tremendous impact on empowering your associate and giving them the platform to grow and develop. And the last thing is, which is always a touchy subject, is partnership. Now, partnership doesn't mean entitlement. It doesn't mean that just because they're working on your practice, they are giving partnership. They have to earn the partnership. But to me, I think partnership is really important because it gives the associate a roadmap that, hey, I'm investing myself in this practice. There is a future for me. I'm going to reap the benefits. For me, if it wasn't a future for partnership ownership, I wouldn't be investing 6 years of my life. But I knew that I'm going to step into a practice where there's a future for me. So you have to figure out what is the business model, how you like to do this, right? Many ways of giving a partnership, 2 years of associateship first, and then they can buy into the practice. Whatever it may be, you have to figure it out. But giving your associate a roadmap helps them to know where there's a future, and therefore they're not going to be thinking, oh, I should go open my own practice. You know what? There's a future for me here where I don't have to take a risk and start something from scratch. So this is the associate moments of onboarding, creating a vision first. Based on the vision, you're able to find and hire the right individuals. Once you found the right individuals, you want to test them as soon as possible, whether they belong to your practice or they see eye to eye in the vision and they have the qualities and the drive that you're looking for. And then the next thing is empowering and partnership. Now I'm going to switch gears and talk to you guys, go over the associate side, some of the challenges that recent graduates face. Well, for starters, American Dental Association did a study that showed the number of dentists who are diagnosed with anxiety has tripled from 2003 to 2021. And you may ask, well, why is that happening? Well, the one thing that's happened to the recent grads is the increased amount of student loan debt. In 1996, the average student loan debt for a dentist was $103,000. In 2020, that number has tripled. It's gone up by 200%. During the same time period, the average income has gone from $170,000 to $194,000, which is only a 14% increase. So that creates quite a bit of stress. In addition to the student loan amount, that now in addition to just running a practice and doing dentistry, you also have to worry about your daily Instagram posts, your daily Facebook posts, and being cool and fun on social media and making your YouTube videos. And let's not forget about TikTok. Because obviously an important part of being a good dentist is having the ability to sing and dance. And if you can't two-step your way to your practice, are you even qualified to see the patients? I don't think so, Kirk, right?
Not at all.
And in addition to all of this, now you need to know everything there is under the sun about teeth and whether magic mud and moon dust or charcoal can whiten my teeth, because you never know what things are your patients Googling and they come to you and ask you those questions. In addition to that, now you need to know what SEOs are and how to optimize your website, because these companies, they know we have no idea what they mean, but they charge us an arm and leg every month for it. And then at the end of the day, when you come from a day of work, then you have to worry about your reviews on Google, ZocDoc, CareDash, HealthGrade, and Yelp, because you never know when a patient is going to be upset and wants to vent to the rest of the world. This is actually a review that a patient of ours left on Google. So it says, worst experience on earth. First of all, this was the first time I ever feel like I have experienced pain during a dental cleaning. Secondly, this lady kept telling me I was going to get cavities. It was like she wanted me to have them. She spent 20 minutes scratching my molars until I told her to stop. Then she told me I do have a cavity, but when I told her to point out on the x-ray, she backpedaled. She couldn't just say my teeth were great like every other dentist in my life. Well, Sarah, we can't tell you your teeth are perfect because they're not. So here's actually a scan of her teeth. And you can see she's got class 2 bite, increased overjet, crowding, spacing, and those molars look definitely very suspicious. And let's not forget about that piece of egg that's been stuck between number 10 and 11. So sorry, we can't tell you teeth are not perfect because they're not. And then here, Josh said, being a dentist isn't stressful at all. And this is Josh at age 35. Now, even though I say all of these things, dentistry is still an incredible career, one that can offer you a lifestyle that most people can only dream about. But how you start your career as a dentist, as an associate, has a tremendous impact on where you end up and how successful you become. Many times, associates or new grads don't really have an idea of where they want to be or how they should go about developing their career. So that's why I outlined the associate career development moments. When you think of a recent graduate, there are really 3 moments. The first one is getting your hands wet. The second one is finding mentorship. And the third one is finding a dental home. And I'm going to go through each one of these stages and explain what that means. So obviously, we all know once you come out of dental school, your knowledge, your scope of dentistry is very limited. So the first practice you're looking for should be a place where you can develop your hand skills and learn the basics of dentistry. Ideally, this is a practice that there's a lot of volume of dentistry where you can really develop your skills. But the challenge with volume-driven dentistry is that you may also develop bad habits. If you want to be a cosmetic dentist and you are at a Medicaid practice, you may not be developing on some of those communication skills that are key in motivating your patients to accept a cosmetic case. But that's okay, because the goal of this moment, one, is really developing your hand skills and learning the basics of dentistry. And the second thing is identifying the area of interest in dentistry. Once you have done these two, then you go to the second moment, which is finding a mentorship. Mentorship is absolutely crucial in dentistry. You can learn the knowledge and the skill that someone has acquired over 10, 20, 30 years in relatively a short amount of time. But you have to know what area of dentistry you're interested in, whether you want to be a super general dentist, whether you want to be a cosmetic dentist, whether you want to be a holistic dentist. Identify that first, then find a mentor. And there are many ways for you to find a mentor. You can, use social media, you can go study clubs, you can even contact your local lab. If you want to be a cosmetic dentist, you can call your local lab and ask them who's a dentist in the area that's doing great work. What's really important in this stage is you cannot focus on the money and the benefits. I know that we have $300,000 of student loans and we're looking for a position to help us pay those back. But this is the time for you to spend to really learn the skills. So don't focus on the money and the benefits. This is the time to learn the knowledge from a mentor. And another way, a good way for you to analyze your comfort level within dentistry is really look at your schedule. Your schedule reflects what you're good at and what you're comfortable with. If you want to be a cosmetic dentist and you have, fillings and extraction on your schedule all day, that tells me two things. Either you haven't developed the skills to be able to treatment plan, or you're not good at communicating that treatment plan to your patients. So use that schedule to understand where you are and what's your comfort level in dentistry. And then once your schedule shows that you have learned the skills to be doing the type of dentistry you want to do, then you've accomplished the goal of moment 2. And we go to the third one, which is finding your dental home. This is the time where you start thinking about long-term, where do I want to be, right? This is the time for you to think about, okay, also my financial, my benefits, how much money I'm making, because you've developed the skills, you got the mentorship, now you're ready for moment 3. When you're looking for a dental home, you have to evaluate the practice to make sure this is a place where you can call your second home for a long period of time. So you visit the practice and you evaluate, do the staff members look happy or they look miserable? Another good way for you to evaluate a practice is to call the practice and, as a new patient and see how they handle the new patient phone call. Practices that are good and they invest quite a bit on one of the most important part of every practice, which is the new patient phone calls. And then the other thing you need to evaluate is whether this practice is open to new ideas and strategies. Because if they just want to mold you to their practice and their business models, you may not be happy. But if they're open to new ideas and strategies, then you have some room to grow. And the last thing is there a future for you at this practice? Is there a partnership? Is there an ownership? If you're not looking for that, then that's perfect. But if you are, then obviously that's an important thing to consider when you're looking to find your dental home. So these are the 3 moments. When you first graduate from dental school, you focus on developing the skills of your hand skills, your knowledge. The second thing is finding a mentorship. And the last thing you should focus on is your dental home. And that's the point where you consider the benefits, the pay, and everything. These moments may happen at one practice, or they may happen at 3 different practices or 4 different practices. But this is how you should think about your career development. Now, once you become the associate, now we're going to go over how you can become the ideal associate. The ideal associate is less about the skills of dentistry and how you treatment plan, but more so about the right mindset. When you come to a practice as an associate, you have to have 2 things. The first mindset is respect for the strategies and processes that have been working in the practice. Many times when you come in as an associate, you start to look down on the systems or ways of how they're doing things. But showing respect could earn you a lot of respect from the management and from the owner. The second thing you should think about is what things can I do that would make me valuable or indispensable to the practice? In other words, that the management and the owner can't even imagine not having me around for a day. I'm going to give you 5 techniques or 5 things that you can do as an associate that will make you invaluable and indispensable to the practice. The first thing, which is very simple concept, is showing up early to work, right? I always try to be the first person in the practice. Granted, I'm not always successful, but it sends a huge message to the management and to the owner about your commitment to the practice. USA Today did a study that showed people who show up early to work, on average, they make $2,500 more per year. And they have 13% less of chance of getting laid off. Something as simple as showing up early to work. So you need to evaluate your morning routine. See what things you're doing that are making you late. It's not traffic that's making you late to work. It's poor planning. I've always been obsessed with what things or what mentality successful people have that makes them so efficient. And so when I studied people that are doing well in life, I realized that they all have a very consistent morning routine. So I developed my morning routine that I want to share with you guys. So my mornings start at 5 a.m. That's when the alarm goes off. I drink a tall glass of water first thing in the morning to hydrate. Then I like to read from 5:30 to 7 a.m. to kind of, this is my peaceful time. This is the time where the day belongs to me and no one else can interrupt me. And then I work out 3 times a week because our fitness, our physical health is just as important in dentistry. And then breakfast, work, and then my bedtime is at 9:30. I'm in bed by then so that way I can get my restful sleep. So this is my morning routine, and this is what works for me. You guys create your own routine that's you're gonna be able to be consistent with it and help you have a good way to approach your day and start your day. Now we go on to the second thing, which is how to become the ideal associate, is being an active member. Many times when we've hired associates to our practice, they act aloof in team trainings or in meetings. They're not really participating. And even though they're great clinicians, they didn't last a long time in the practice because you guys all know that the most important part of every practice is that team culture, team mentality. And even though as an associate, you're not the owner, you still have a chance to become a role model because staff members do look up to you. When I started working my uncle's practice, being that it was a family practice made it a little bit easier, but I decided that I'm going to treat this like my own practice. So if I walked by and there was some trash or the floor was dirty, I didn't walk by thinking that this is not my job. Someone else has got to get that. I got a broom, I got a mop, and I cleaned the floor. And what's amazing is that the staff members, 9 out of 10, if they saw me do that, they will come grab it from me like, no, Dr. Bahrami, we'll take care of it. And it collectively increased their awareness of the hygiene of the practice. So don't think that I'm an associate, it doesn't matter. It makes a huge difference. You still have an opportunity to be a role model and play a key role in creating the team culture. The third thing is introducing new ideas and procedures. Now, this is a bit tricky because you have to make sure that the practice is open to it as an associate. But if the practice, most of the time, they do the same type of dentistry for 10, 15 years. And if you're doing that, chances are you're really missing out on optimizing production, collection, and bringing new services to the practice. But as an associate, you have a unique opportunity because you're bringing a fresh perspective to the practice. So you can evaluate the patient demographics to see what things that can be added to this practice to increase the services that is provided to the patients and also improve the collection or patient experience. When I came to the practice, I was a young dentist coming out of school, and my uncle had specialists that worked for him. He was a super general dentist. I really felt like there's not much that I can bring to the practice that's going to improve because I didn't have much knowledge or skill yet. But one thing I noticed after working for a certain amount of time that I saw that they're taking the before and after pictures with iPhone camera. And I talked to Dr. Ben and I said, why are we using iPhone camera? Well, he said, I've bought multiple cameras, but no one uses them. I did some research and I found out that the reason they're not using them is because they were never trained, right? It's not something as easy as point a camera and shoot. There's actually a technique to it. So I bought a camera, I invested in a course and learned the skills, and I started taking the before and after pictures with a professional camera. And it transformed our social media presence, our portfolio. And you could see that patients would see our work online and they will come to the office and they'll ask for the same thing. So As an associate, you don't really need to bring like all on X cases or do complicated procedures. It could be something as simple as dental photography or bringing digital smile design. But this is a unique opportunity to be adding something to the practice. The next thing is follow-up calls. This is a very important way to develop your patient population when you first enter a practice. My system is anytime I num up a patient, I call them that day at the end of the day to see how they're doing. And most of the time, the conversations are like 20, 30 seconds where patients say, you know, everything is fine. But this sends a great message to the patient that I care about you, right? And as the saying goes, no one cares until they know you care. That goes a long way because then those patients become advocates for you and they start recruiting patients to you. Another thing that you should be doing in your practice is doing exit interview. And this is owner or associate. Anyone can do this. Not many practices are doing. Many times we hear so-and-so patient is leaving and they want their notes and their chart. We sign off and then we send the documents to them. But a patient who is not happy with your practice is a good way for you to get an evaluation of what is your shortcoming. You can call them and talk to them to see why they're leaving your practice. This is a great way to show that you care, and many practices aren't doing this thing. Another thing is that you can learn what are the shortcomings and where there are opportunities for you to improve your practice. And the last thing is think bigger picture. Don't focus on money. When you join a practice, think about how can we elevate the practice. Don't focus on how can I make money. And we had that challenge in our practice because we had multiple locations. For example, one thing that was a challenge is that a dentist would start an Invisalign case, and now another dentist would have to, another associate would have to deliver the attachments. A dentist would complain that, hey, I didn't get paid for this Invisalign case, so why do I have to deliver the attachments? But to me, every chance to develop a relationship, a rapport with a patient is something that you should jump on and not say no to it because you're not being compensated. I welcome that. I would go in, deliver Invisalign case, have a conversation with patients. If they're finishing Invisalign, they would need some cosmetic work, and I would treatment plan it. And guess what? I would be the one that does the treatment plan. So really approach the practice with the mindset that how can we improve the practice and not just me making money. And if you really approach it with that mentality, you're going to have patients line up and waiting for you for months in order to see you. So a lot of things we talked about, that dense lecture, we talked about the general attitudes and mindset of owners and associate. We talked about some of the challenges of owning a dental practice. And we talked about challenges of corporate dentistry. Now, how it's, even though they have their own challenges, it presents an opportunity to us to become successful. And then we talked about the process of onboarding and hiring an associate. We talked about challenges of newly grads, the moments of associate career development. And we also talked about some of the things and techniques you can do to become the ideal associate. Now, my final thought was that I mentioned something during my lecture that one of the most important things as a dentist working in 2024 is having the ability to dance and sing, and I'm going to prove it to you guys.
You can actually hear me two-stepping while I'm recording this, you know. This is the remix. You know my bankroll. Got a lot of zeros. Teddy Payne. The Tallahassee hero. I done got a crib. Now I'm in the A. Two-stepping, let me show you how I do this thing. Take your left foot, put it out in the front and do it like this. Now if you
I showed this video because this guy is a dentist and he's a remarkable dancer. But the second reason I showed this video is because this video got 2.5 million likes on TikTok. I don't care what type of marketing company you've hired. There's no marketing company that can create an ad that's going to get you this much visibility. So I'm working on my dancing and singing skills so I can post videos. If you already know how to two-step, you're ahead of the game. So thank you so much for giving me your time and your attention.
Awesome. Thank you so much.
Sean, that was excellent. Just excellent.
Thank you.
I really appreciate it. I mean, first of all, like, very well done on making this a powerful day. I actually learned a lot. And I've got some new terminology. I love the Red Sea thing. That just makes so much sense. And how I have a bunch of questions. And number two, I think you do such a great job of presenting. Like we see a lot of stuff, and Angie, I think you can echo. Like some people like are really good at what but they're not great presenters. The force is strong with you. Like I could see you being an excellent teacher in the future, and you're super engaging. I got a private message from Laura. She's like, "This guy's awesome." I know he's awesome. Yeah, that was wonderful.
I appreciate it.
Yeah.
Thank you.
Are you okay staying on for questions? I'm sure people will have questions.
Yeah, absolutely. No, I'm here.
So go ahead. I've asked questions. I have some questions and thoughts I'd love for you to talk about, Sean, but I always like to.
Sure.
And Ange, do you have any questions right out of the gate?
Not from our attendees yet, but I just want to mention that you guys, if you don't want to turn your cameras or mics on, you can add them to the chat and Kirk and I will read them for you. But you certainly can turn your camera on if you want to do that too. And also the CE information is in the chat as well. So head there to get your CE link before you wrap up.
I want you to comment on one thing. I love how you presented the differentiation thing, because we talk about that a lot. And one of the pushes we have for our community is, in order for people to come to you and pay your full fee and be out of network, possibly, because you really do have to differentiate yourself. And you presented the idea clearly. You said it really well, is that a lot of corporate dentistry, they have to do less differentiation. Can you just expand on that a little bit more?
Yeah, and that's a concept. I actually came across a dentist who was practicing in LA, and he's doing something very interesting. So he is a cosmetic dentist, but he is partnered up with tattoo artists. And what they do, they put the patient to sleep. He does his full mouth rehab and cosmetic case, and the tattoo artists are doing the artwork on the patient's body. So you wake up, you got a brand new smile, and you are tatted up. And, to me, that is blue ocean strategy. And that's not that many people are doing that. And dentists always stress about, all these dental offices are opening, the market is becoming saturated. There's so many corporate offices. But that's what's great about dentistry, is that you really can figure out a way to make your business a unique business, your approach to dentistry, whether it's biological dentistry. In our area, the holistic and biological dentistry are absolutely killing it. They're doing so well because there's so much demand. So that is something that we have that corporate dentistry doesn't have. Corporate dentistry can never open a tattoo shop with a dental guy, because that's really a personality trait from that dentist that resonates with patients. So I think we really have a great opportunity to differentiate ourselves and become that unique practice where it offers something different to patients.
Yeah, love that. You also did an incredible job of really explaining the transparency of the situation with your family.
Yeah,
really well. You don't see that a lot, where people actually put numbers. And my first thought is, if I did that to my uncle, I don't know that he would invite me over anymore, because I revealed too much. But I would love for you to go back to that and just really share with us a little bit more of the complexity of family and how, because I think you had a really good idea going in it, but I think a lot of times in our community or anything in dentistry, people don't understand the complexity of family in business. Can you just point to that?
Absolutely. And it's tricky because you're joining someone's practice who's already been doing dentistry for 25, 30 years. And then you also have that family relationship where you are not super comfortable at vocalizing what you're thinking. But I've always been on the side that if I keep anything to myself and I don't say it, it's just going to create tension in our relationship. I think me putting my ideas out there and him understanding where I'm coming from will help us really make decisions together. And so it was hard for me. There were a lot of moments of like my heart beating fast and my hands are sweating. And I want to tell him that the way we're doing things is not right and we should change this. And, obviously I didn't use those words because that would create quite a bit of issue, but really showing him that, and I think part of the reason that he was so open to the ideas and me being there is the fact that I treated his practice like it's my own practice. What we talked about, those things of 5 things that you do as an associate, I really did do those things. I would call patients to see how they're doing. I would call them if they were leaving our practice. I would focus on building the practice, not me making money. I didn't care if I wasn't compensated for something. I would redo work that another dentist in our practice did and not think about my compensation. Once I did those things, he saw that, okay, he really does value the practice, and he's started to be more open to new ideas, and which really helped us to grow.
Yeah. We did get a question in the chat. Speaking of compensation, how is compensation determined? Or do you have any thoughts on that?
Compensation in terms of the associate compensation we're talking about?
I'm guessing.
So.
Yeah.
Yeah. Yes. Okay. So, in our practice, what we did was we created the compensation package to be a percentage of your collection, right? We understood that in the beginning, when you're coming in and joining a practice, we always like people that are newer in their career because we can really help them grow. And then they're also more easier to kind of shape into what we're trying to accomplish.
Was it crazy as 38?
Sorry about that.
That's good. So what we did was we give them a percentage on the collection. So typically the percentage goes anywhere from 32% to 35%, depending on the associate. And then obviously giving, deducting the lab fee, the same percentage. And then they will get their benefits. Now that we are bigger, we're able to offer some, vacation days, PTOs, CE course money. So to kind of be competitive with the corporate world of job offers.
Yeah, love it.
I hope that answers the question.
Yeah, very well said. Another, again, I hate to monopolize all the question asking because I love your topic, is I love how you put 0.0 in there in the vision. And can you speak to this? Because this is a challenge with many dentists, is trying to figure out what you're building before you bring in an associate. So we always say it's great to bring in an associate, but like call out what you're doing. Are you bringing in associates to grow them so that they can lead, or are you bringing somebody in to do the garbage dentistry while you're the predator at the top of the food chain, taking all the beautiful dentistry? And that's okay too, as long as you call that out, type of a thing. Can you speak to, because I think a lot of people go in and they don't even really have an idea of what they're building, nor they're nurturing. And let me add one more layer. I love scenario 1 where you're growing people, but you are going to have to be prepared that their compensation is going to have to come from somewhere. And if you're living a comfortable lifestyle and you're like, you don't have a retirement plan, that's a tough one, right?
It is a tough one. I mean, you hit the nail on the head, because the challenge was, and I don't know if this was my experience with my uncle or this is how the owner generation, they're not so much about vocalizing what they're trying to accomplish, right? So he would have an idea in his head and he would think that we would be on the same page, but that's not the reality. The reality is these things need to be vocalized. Everyone in the practice should know what we're trying to accomplish, what are our goals, where we stand, and so having that clarity really helps your associates because they know. So you shouldn't be making decisions for them that, hey, you're going to do the garbage dentistry like you talked about, without actually you explaining to them that this is not, don't tell them the garbage dentistry, but tell them that what you have a vision for them, which will help them be a lot more engaged and understand where the practice is going. Because not knowing where you stand in the practice or not knowing where the practice is headed, it really creates that ambiguity that it's hard to wrap your head around, and you really don't know where you stand in practice. So absolutely, the vision needs to be clear. It needs to be kind of, discussed with people so they are aware of what your vision is and where you're trying to go with this.
Love it. Now you're probably gonna have the same or similar answer, and please ask questions if you guys have them. So here's another one, and I'm getting older, so I don't care. Here it comes. I'm just gonna share with you what we hear, Dan, and I love the people we serve is, there's two difficult scenarios bringing an associate. Yeah, I got this associate. Yeah, they just want to work part-time. They're just looking for a couple days a week. And then 6 months later, they're like, well, they're not really driven. Like they don't but there's a 3-hour opening. They're looking at Facebook,
Yeah.
And then you got the
Yeah.
other end of the spectrum where you're like, wow, this person's really driven. They're asking me about equity all the time. And they're out producing me already. Like you kind of get what you ask for in some respect. Walk us through that, because these we get bombarded with these.
And that's why when I made that associate test, I did create that portion for the candidates drive, because one thing I've learned of hiring doctors, now we have 9 doctors working with us, but there have been many people that have come and left. And, we learned through that is that you cannot teach drive or motivation. There are certain things that you can teach. You can teach how to do dentistry. You can teach how to communicate with patients and learn those skills. But if you're not driven, this is not going anywhere. And I've noticed that multiple times when I had a specialist work in our practice doing an implant case or a cosmetic case or full mouth, like a prosthodontist, regardless of whether I know how to do that or not, I would go watch them if I don't have a patient. But we had associates that, like you said, they will be on their phone and they would be, not really engaged. So one thing I learned is that if the person doesn't have a drive, we're not going to waste too much time. You can really engage that from the beginning of how they are active and how they're participating with the practice. And so if this is not the person, then that we go different separate ways. But the other point is having someone that has a lot of drive, that's also challenging in the sense that you need to be able to provide and cater to them with that drive of, yes, I want a partnership, I want equity, I want this and that. And that could also present its own challenges in the practice for an associate. But I think part of what I like of being on that compensation package, like for someone, like I had the drive, if you want to make more money or increase your collection, then you being on percentage, you really, you're at the end of the day, you're compensated for what you do. And obviously having a roadmap of a partnership for people that are that driven really helps to kind of anchor them and keep them in your practice.
Yeah.
Because it goes the opposite way too. Sometimes the owner doctor's stressed and doesn't have the ability to see all the patients. And so they'll want to add someone just for a day. And then
makes a big difference.
Right.
Yeah.
And the other thing that I noticed is that how owners speak about their staff members really speak volume about their leadership. If they always talk about their staff members as if they're the source of all problems, then obviously that means a lot that your own leadership skills are not so great, because how successful your practice is really a reflection of your leadership in the practice. So elevating your associates, how you speak about them, it really makes a tremendous difference.
Totally agree. And
I have a couple of questions sorry, Kirk.
No, you go.
That came to me privately. It says, what is the market looking like for associates? Realistic timeline to find the right one?
For our environment, I don't know. I think it varies from area to area, but in our environment, where we are in Bethesda, Maryland, there is a huge demand for associates. You're not going to have an issue finding a job, but finding the right job, finding the right mentor, that is not easy. It's always going to be a challenge of you figuring it out. But I think, approaching it with finding an office that, depending on where you are on that associate timeline of career development, whether you are just graduating, you want to get your hands wet, or whether you know what you're interested in and you're looking for a mentor, or you're looking for a dental home. Those are all different things. I think finding a volume-driven dentistry is pretty easy, right? There's a lot of offices that take Medicaid, Medicare, that you get to do a lot of dentistry. Finding a mentor, finding a dental home, those are not as easy to find.
And then the next one is similar to that, the recommended amount of time as an associate prior to partnership opportunity.
Yeah, what we decided to implement in our practice is really 2 years of working, because that gives you enough time to evaluate and really understand what that person is about, their skills, their understanding. And then after 2 years, they have the opportunity to buy into the practice. So to me, I think it really varies from different people, have different business models, but I like the 2 years of time period because it's just like getting married, right? You need some time to understand whether you're on the same page and whether there's chemistry between the partners.
Love that. One other question, Angie, any other questions privately at all?
Do you have a price? Do you have a price of that prior to the 2 years?
Do we have a what price? The price, sorry. Like whether you choose the price to buy into the practice before the 2 years?
I'm guessing that the question is like, what's the value? Oh, here it is. What's the value of the practice?
Yeah. So the way we went about, at least me becoming a partner, is the practice was valued that, after 2 years, but we also considered how much I have brought into the practice, so that got the value of the practice adjusted, because it is in a way not so fair for you to be paying at that increased amount, even though you have brought some value to the practice. So we found a number what we agreed on that was adjusted, so that way both parties will be happy. But it's a bit tricky subject.
Yeah, it's tricky. And I've heard so many people generalize it. It's valued before you start, and then current day, and then you split the difference and try to find, but there's that's for a whole nother conversation.
Yeah.
We're always curious about that. Yeah. I do have a question on team. Go back to team. This isn't specific to just associates. It can be specific to partners. We see it a lot where a dentist will say, this is my team, that's your team, type of a thing, and they separate the team. Can you just speak to what your philosophy was and how you both integrated? Are any of the team members doctor specific or not so much?
Yeah. What we did was, now we're at a point where we, at least the staff members are they stay in one area, right? Each office has their own staff members, a front desk, the managers. But what we decided to do, for the sake of the assistants, they will stay with the doctor, because you learn the preferences of one dentist, makes it a lot easier versus, because it's going to get confusing for them. So each office, the doctors do rotate. I rotate between 3 offices. My uncle rotates between 3 offices. Other doctors, not as much, but for us, because we wanted to have a presence in each office as the dentistry is being done. But then the staff members, they stay in the location, except for the assistants. Assistants, because they work with one doctor, they get comfortable, they know their preferences, they tend to follow the doctor in the different locations.
Awesome. That's great stuff. Cool. Any other questions? That's so good. What's the road? I always want to know this. Like, what's the road ahead look like for you? Not only just you and education, but the practice. Like, what's the future vision? So if we did a follow-up 3 years, what are you sharing with us in 3 years? What do you hope?
So, and I think she said, talk about a dental wellness society. I do want to discuss that a little bit, because
Please.
I've always been passionate about fitness and dentistry. And I realized after working for 5 years with different dentists, how dentists really suffer from emotional exhaustion, from mental and also physical exhaustion. So I decided to create a society where we basically plan once a month in-person fitness session of some sort, and it changes. 1 month might be yoga. Our next event is actually boxing. And then we also do webinars. So we bring in experts in nutrition, experts in spine health, in building successful habits to really coach and help the doctors, the hygienists, the staff members to optimize their overall well-being. So my vision is really to be able to grow this dental wellness society into something that can have multiple chapters. It can have conferences, retreats, and really spread that awareness for health. Because I mean, Kirk, I don't know if you heard that, but I got that so many times when I started as a dentist. Do you know dentists have the highest suicide rate? And so, that stereotype was around us for a long time. So I really want to promote the health and the awareness in the community and grow that organization so everyone has a chance to be a part of that. So that's a nonprofit goal. Where we are with dentistry and the offices, we're actually in the process of building the 5th location. So that should be opening up at the end of this year. I love the business aspect of dentistry. So we would like to kind of fine tune things, improve the processes to really be able to grow that. And then one day, I hope that I could continue to, talk and do the public speaking and kind of give back to the community, because I really do enjoy interacting with people and having opportunities like you guys gave me.
Oh, we'll definitely have you back. So I could see that being a huge part of your future. You're so good at it.
Thank you, Kurt. Appreciate it.
There's one final request. If you could either share your screen again, or if you just want to maybe type in the chat your contact information, how people
can share the screen. Are you able to see it?
Yes.
Yeah.
Oh, it got a little bit fuzzy for me.
There you go. Very cool.
There we go. Perfect. Thank you.
Of course, my pleasure.
Yeah. Well, I don't think we have any other questions, Sean. That was incredible. Thank you so much. With your permission, I'd like to actually make this available for a lot more people than just our masterclass. I got a request. Can you share this recording with me? And I'd actually love to share this. I don't know where we're going to share it, but I think what you shared today was so powerful, so good, and insightful. I loved it. Thank you so much.
I'd love to. Thank you for this opportunity. I really appreciate the podcast. I enjoy talking to you guys, and look forward to having more conversations in the future, and also learning from you guys as well. So thank you so much for this.
It's our pleasure.
Awesome.
Yeah. Cool. Anything
Thanks,
else?
everybody.
No.
No. Next week we'll be back with Dr. Jim McKee. So come back.
All right. Sounds good. Have a great weekend, everybody.
Have a great
Thank you so
weekend.
much.
Thank
Bye.
you.
Bye-bye.